I'm Richard Gracie, Data Manager at the MRC CTU. In this presentation, I will go through the procedures for the assessment and follow-up of patients on the STAMPEDE trial. The follow-up schedule is shown here. Please note that after 6 months, this should fit in with the likely usual follow-up for these patients. The earlier 6 weekly visits are performed to get good PSA nadir data and good toxicity data in the early treatment phases, and also to get consistent assessment timings across each of the trial arms. At each visit there should be a clinical assessment, the details of which are to be recorded on the follow-up CRF. If the patient is consented to the quality of life study, then a quality of life and health economics form should also be completed. Page 2 of the follow-up form is shown here. This is where toxicity data is recorded. There are 18 different categories on this form, all of which are related to common reactions named on the SPCs of the trial drugs. For each category, you must answer yes or no as to whether the patient has experienced any of the toxicities in that category. You must then give a value for every toxicity within that category. If that particular toxicity has not been experienced, please enter 0. The specific toxicity questions are not yes or no questions. You must enter the worst grade experienced. The details of each cycle of treatment must be recorded on the relevant treatment form. For zoledronic acid, the details are recorded as 2 cycles per CRF for the first 6 cycles, and from cycle 7 onwards, it increases to 3 cycles per CRF. For docetaxel, it's 2 cycles per CRF for all cycles. For celecoxib, the details of treatments are recorded on the follow-up form at each follow-up assessment. Details of the additional CRFs and when they are to be completed are shown here. The progression form is to be completed whenever there is evidence of progression. The radiotherapy form is for whenever radiotherapy treatment is completed. This is only for patients having primary radiotherapy, not radiotherapy for progression. The late radiotherapy toxicity form is to be completed at 6, 12, 24 and 36 months after the start of primary radiotherapy. The end of treatment form is for whenever a patient discontinues any trial treatment. The death form is to be completed whenever a patient dies. If you have any queries about the assessment and follow-up procedures, then you can contact us on any of the below numbers.